Healthcare is full of big decisions, and patients are often asked to make them with too little clear information. That gap can affect trust, safety, compliance, and outcomes. But when education is clear, timely, and easy to understand, patients can take a more active role in their care. On the Closing the Care Gap podcast, we talk with healthcare professionals about how they educate, guide, and support patients, providers, and practices. Together, we explore how better education can lead to safer patients and better outcomes. Our mission? To turn confusion into clarity at every step of care. This is Closing the Care Gap, presented by Volabright. I'm your host, Lars Helgeson.
All right. Thank you very much for joining me. This is Jacfranz Guiteau. You are a physician, transplant surgeon based in Tennessee. I would love to learn a little bit more about you and where you started, where you came from, and why you chose the not so easy path to be a surgeon. How did this all happen?
Lars, thank you very much for having me on today. I think everybody's journey into medicine is different. A lot of people will say they grew up wanting to be physicians. I didn't necessarily follow that path. My dad was a physician. And, when I was younger, I was a little bit rebellious, and I was telling myself, I'm going to do everything I can to be the opposite of what my dad did. Not because we didn't have a great relationship, but just because I wanted to kind of prove myself for myself. But as I was going through undergraduate work, I realized that I really enjoyed the sciences. But mostly I really, really enjoyed the ability to interact with people. I think the communication and the connection you make with patients is ultimately the most rewarding thing for me. And, the marriage of medicine and humanity, or science and humanity in medicine, is what ultimately made me decide, after showing up as an undecided in college, to eventually going the pre-med route. So that was shaped through different experiences while I was in college. I did a lot of mentorship. I did some research as well. And that just kind of shaped my overall view of what I wanted to do as an adult. So that's what eventually brought me to medicine. When I went into medicine, I did not expect to be a surgeon. I actually was very interested in infectious diseases. I lived in South Florida growing up, and my dad did a lot of work with HIV patients very early on when HIV was kind of brand new. And being Haitian American, that struck home because, Haitian was one of the risk factors for HIV. And so there was a big stigma attached to that in South Florida at the time. And so I thought I was going to go into infectious diseases and cure HIV, right? But as I started going through medical school and doing rotations, I realized that I wanted something a little bit more immediate impact. I really enjoyed surgery and the fact that I was able to address a problem, have immediate results, and have that patient go on to lead what will hopefully be a normal life. The thing I didn't like about surgery is that you saw them for follow-up and then you never saw them again. And that's where transplant came into play, because we operate on patients. They do well. They go from being on dialysis to now off of dialysis. And then I see them for the rest of their lives. And so I see patients in my office who I transplanted 1, 2, 3 years ago who say, "Hey, Dr. G, how are you? My kidney's doing well." So I get the best of all worlds. I get to operate, and then I get to see people years down the line after I've operated on them to see how well they're doing.
God, that is so rewarding. I just, the ability to change somebody's life. And then, like you said, to have them come back and see them functioning and happy and able to do all the things that they were able to do because of the work you directly were able to perform. So, we were talking a little bit before the podcast started about our dads. Both of our dads passed last year, and how important they were informing the paths that we took. And clearly, your dad was doing very important work. How did that change the way you see your career and the path you chose and how you talk to patients?
My dad was a family medicine doctor in South Florida, and he took a lot of pride, especially in South Florida, dealing with the Haitian immigrant population, being Haitian ourselves. And, I think what he really showed me is when you have an ability to really affect change within a population or a segment of the population that may be misinformed or uh, not well represented, or don't have all of the information that they could potentially use to inform decisions on their healthcare, that you have to really, if you have that ability, that you really need to take that seriously. And so I look at the end stage renal disease population in the United States, or chronic kidney disease population in the United States, and look at how uh, when you view such a large group of people, how there's so much not misinformation, but more lack of education surrounding choices for treatment when you start to develop end stage kidney disease, and how the majority of these patients are going into dialysis when we know as a medical community that dialysis is not a full life compared to transplant. And a lot of people don't even hear that message. And so I think my dad's journey in terms of trying to message to his patients the need to take ownership of your health really is something that I hold strongly to. And I always am telling patients that you need to know the good, the bad, and the ugly of your healthcare so that you can make informed decisions on how you want to live your life. And so I always tell patients, my job isn't to convince you to do anything. I'm just here to educate you and then support you in whatever decisions you make.
And that is an important distinction, right? You're not making decisions for them. You're giving them the freedom to make their own educated, informed decision. And would you say that in talking to the different types of populations that you work with, I mean, in Tennessee, you've got a broad range of different demographics. Um, what do you see as sort of a common theme amongst all of them in when it comes to what they need to know about their health?
I think a lot of people, when they come in, especially into our center, they don't know. There are a few things they don't know. I think they don't understand the gravity of their disease process in terms of numbers and statistics. And you wouldn't expect someone to know that information, right? That's something that you and I may read in a journal or something in a textbook. Um, but I always say that, just because you don't know the statistics doesn't mean that those aren't what's real, and I think what's important is that people need to know what's truly out there and what that means for them. Um, and that when making their own healthcare decisions, they really have to take into account not only how it's going to affect them, but in particular in transplant, you have to look at how that's going to affect your support system, your family. Um, a transplant success is really a full on, full court press for a family regarding what the patients are going to need in the perioperative and post-transplant periods. And so it really, really does affect the entire village. I always say the transplant center is an extension of your support system, and it really does take a village. And so I think when patients come in, they're not expecting that level of involvement from the transplant center or their family. And not knowing that they're going to need that in order to be successful. And I think a lot of people leave from our education saying, I did not know that this was so involved. But also on the flip side, they go from, 3 times a week dialysis, and where they don't feel really well in between sessions and they're not able to travel and not being able to eat what they'd like. They go back to a level of functionality and energy that they hadn't experienced in years. And so, the trade-off of, especially in that early time recovery, turns into a very, very fulfilling life with, a life expectancy that's doubled compared to staying on dialysis.
Yeah, and when you give someone the gift of life, that is a real thing. Now, when someone comes in to meet with you for the first time, like you said, they're going to have some preconceived notions, or they may not have much information at all. What do you see in terms of misinformation? You can always Google things, you can always go on AI, and I suppose access to those are probably dependent on the culture and the socioeconomic status of the people you're talking to. What what do you see when someone sits down with you, say for the first time, where they come in and you have to sort of re-educate them on things that are sort of whether there's misinformation or some social influencer decides that they're going to, make a cause out of something that gets them a lot of clicks. What do you see and how do you combat it?
We have so much access to information just from what you mentioned, with Claude and Chat GPT and OpenAI and all these things. People have access to what they think is infallible um, information, and I think we have to be very careful. I always start every interaction with the same question. I say, I introduce myself, and then I say, "What questions do you have?" And I think that helps to set the stage for where the conversation is going to go. Sometimes people have have a lot of questions. Sometimes people say, "I don't know what questions I should have," and that kind of gives me a sense of where I need to start. And so by asking that, I'm hoping to make it so that they realize it's going to be a two-way conversation, and that they're going to talk about information, and I'm going to talk about information as well. And then we kind of start down the path of figuring out, what their medical history is. How does that fit in with what their choices are? I think a lot of people equate dialysis to transplant in terms of outcomes, and maybe not equate them. Like, I think they probably know a functioning kidney is better than dialysis, but I don't think they know how different those two are in terms of even looking at 5-year survival, right? I said I did not want to talk about statistics, but I have to throw these numbers out there. 5-year survival on peritoneal dialysis is about 44%. 5-year survival on hemodialysis is about 42%. 5-year survival with a functioning kidney transplant from a deceased donor kidney is 80+%. And survival with a functioning kidney at 5 years with a living donor kidney is 90+%. So you're looking at huge differences in survival advantage. And then, of course, the quality of life that people have when they have a kidney transplant as opposed to dialysis. So I think figuring out where a patient is and what their level of understanding is of their disease process is the most important thing, because then you can start to tailor your discussion based on what that is. And so starting with an open-ended question and allowing them to kind of get their vulnerabilities out on the table immediately allows me to start to structure a conversation with them that hopefully leads to them feeling comfortable with their decisions.
Absolutely. So when you sit down with someone, do you feel like there is a pressure for them to not admit that they don't know something, where you kind of have to say, well, let me draw it out of you to find out what you don't know? Or are people generally very open and inquisitive and saying, if I don't know something, tell me all the things?
I definitely have a reputation for being not blunt, but I don't sugarcoat things. I think there's a little bit of paternalism in medicine. I think, and we think that patients uh, can't process really disheartening news and things like that. I think it's important that we be very upfront about discussing, especially when we're discussing these things with the patient who has a disease process. We have to be very upfront, and so I think people, once they realize that I'm not going to hold back in terms of giving them information. I mean, honestly, there are times where I say I don't know things, right? I think your physician is human as well, and that I don't necessarily know or have all the answers to their questions, and I'll admit that. And so when they see that, we are having a conversation where yes, I may be the subject matter expert in the room, but I'm not the subject matter expert in the entire world on everything. So I think once they notice and they feel that there's that level of, I am also fallible in this situation, and so we can have a discussion, I think that helps to break down some of those barriers. And I think when people start to have a conversation with me, if they feel like they can't, verbalize that they don't understand something, by the end of the time they're with me, that they feel much more comfortable.
Yeah, of course. Yeah, the feeling like they can talk to you about anything really is obviously critical. How Some of the things you talk to them about though are pretty complicated. I'm sure at some point you've got to discuss the anatomy of the kidney and all, and then you've got to talk about lifestyle things. There's a lot of information. Some of it's complicated. How do you break it down so that they can understand. And it's like we were talking a little bit before, that language can also be a barrier. How do you break all that down in a way that a patient's going to understand what you're saying in all the nuances and all the complexities that you have to communicate to them?
Yeah. Now, I think I use a lot of hand gestures and pointing to things, right? I think, a quick anatomy lesson is always important. I always start with a quick anatomy lesson for our patients so they understand where their kidneys are. I give them a very, very truncated description of how your kidneys work, um, and what their function is. And then I say that's how a healthy kidney is supposed to work. Um, your kidney obviously is not healthy and it's not working like that. And so you need a transplant. And this is how a transplant compares to that healthy setup. And then I kind of highlight how it's different. The first thing people are amazed by is that we don't remove your native kidneys. The kidneys that you're born with stay in place. We do not disconnect them. We actually are just adding another kidney in another spot. I think that's probably what gets most people to kind of say, what? Oh my gosh, I did not know that. And so by laying the foundation of what healthy looks like, and then how that functions and how this new transplant kidney is going to be placed and how it's going to function in the same way, gives them a sequence of events that's I think people can follow it really well. And then once I get through that, it directly leads into my discussion about what the operation looks like, where the incision is, what connections I make. And then after I talk about that, I immediately go into what post-transplant looks like in terms of their time in the hospital, potential complications, how we look for those complications, what we would do if we saw some of those complications. And it generally is a pretty good flow from, general anatomy all the way to hospitalization and eventual discharge from the hospital. And then, of course, I tell them, if you have questions during any point in this, at any point during our conversation, stop, ask me, interrupt, because the whole point of this is for you to have an understanding of what your healthcare is going to look like. And sometimes people wait to the end, but I tell them, if you want to discuss something I'm talking about, stop me in that moment so we can have a discussion.
Right. Right. You mentioned before, when you have a conversation with a patient, how in many ways they are, they come in from a wide background, and you want this to be a conversation where they feel like they're talking to a human. And I think when you're talking to, as a layperson talking to a doctor, you kind of assume that they know everything. You kind of assume there's a sort of this mystical shroud of knowledge that comes with you, where there when you have to be real about the fact that you don't actually know everything, and you still have to engender this sense of trust in you. How do you do that? And there's also a lot of people that have a just general mistrust of the healthcare system and hospitals and doctors. How do you navigate through that? How do you educate them and get them to remember what they know in an environment where trust is not always clear, and people come with these sometimes very traumatic experiences in their past that have nothing to do with you? How do you navigate through that with such a broad background in personality types and cultures?
It's tough. Um, I think I go into every single room pretty open. Um, like I said, just kind of laying the initial groundwork of, this is a conversation about you and your healthcare, and I'm here to help you make decisions. I think by asking even our patients who, using an interpreter, coming in and saying, my name's Dr. Guiteau. The way I always like to start things off is to see if you have any questions. I think putting the power in their hands at the very beginning, um, hopefully starts to put them in a position where they can feel comfortable talking about some of their most vulnerable times in their lives, right? Medicine is one of those things where you meet people at their most vulnerable moments. Um, and just say, and just kind of always recentering on the fact that the most important person in the room is you. And, there are definitely times where even that doesn't work. And, you're having difficult conversations with difficult patients. And, I think always circling back to, hey, this is all about your healthcare and your decisions. And I also let them know that it's okay that if we're having a conversation and you disagree with something I say, or you disagree with this process, you don't have to go through it. You don't, transplant is not for everybody. Yes, the vast majority of people who get transplanted will do well, and it's better than more than likely better than dialysis if they can get through the process. But yes, transplant is not for everybody. Not everybody's going to qualify for a kidney transplant. Um, and so, I think that there's a lot of emotion that comes with those types of the conversations and discussions, but always just trying to sit back and allow the patient to guide that is the most important thing. And, I think when we start to try to guide it as physicians into what we think people should do or what we think is the correct way to go about, that's when you start to lose that trust. And, it's really fragile. It only takes one or two moments where a patient can go from feeling comfortable to a patient saying that this is not where I want to receive my care. And so we go to great lengths to try to make people very, very empowered at every point of the process when they're getting evaluated for a kidney transplant, and give them opportunities to, ask questions from, if they don't want to ask questions to the physician, they can ask questions of the nurse coordinators, from the social worker, pharmacists. Like, we have a lot of people who go in and see these patients, and they have a bunch of different avenues to have different discussions about the same process. So also, by having a multidisciplinary approach, it gives people multiple opportunities to voice what concerns they may have.
At the center of all of these conversations that are having, really, it's about education. Before they get on the operating table, everything is about educating them, like you said, to be empowered to be able to make their own decisions. But in my conversations with other clinicians, I was just at a conference, and I asked a lot of people that are patient facing, and I said, of the conversations that you have, what percentage of the information that you give to a patient do you think they actually retain? And I got numbers everywhere from 10% down to 2%.
Yeah.
So how do you reinforce that? You've got a patient that's under a lot of emotional and psychological stress. They're sitting in a hospital that's not really their comfort zone. They're having conversations about things that are complex, learning about anatomy at the same time. How do you get patients to absorb the things that you're saying? And obviously, there's lifestyle changes that most likely need to occur. How do you get them to remember?
I think the best way that we've seen is, and I don't know if this works for everyone, but I think repetition is really important. I think those numbers in the single to low double digits is probably right in terms of retention. People obviously remember the things that make them uncomfortable. So when I tell them they're going to have a Foley catheter in place, or they're going to get a stent removed through cystoscopy, which is, it is not a very comfortable procedure when you talk about it. They remember those, right? But they don't remember some of the more nuanced things that we talk about. And so what we've set up in my hospital system, we completely revamped our initial education. So when we have patients come in for the evaluation, they go through a video that we put together, which is me talking about all the different steps and things. It's about an hour long. So they sit through an hour of me talking. If they are awake through that, they then go on to the eval where they meet with all of us. And I also, when I'm in the room with the patients, I go over some of that same information. If they get listed, they come back yearly for an annual visit where they will get some of that information again if they haven't been transplanted. We also have a waitlist training class that goes over a lot of that information again, where every patient who's waitlisted has to go through our waitlist training class. And then once they get transplanted, they get a transplant workbook or a transplant notebook that has a lot of information that we've gone over previously. They go through an extensive education in the hospital with our transplant coordinators, pharmacists, dietitian, social worker. And then when they leave the hospital, they come back to see us twice a week for the first month, once a week for the second month. every other for the third month, and then monthly after that, where we are constantly going over education as well. So repetition at first before they get transplanted is what we've used. I don't know if we do a better job of having people retain information. But I think also once people go through the process and they've been transplanted, it becomes just a pattern. Repetition for them is just kind of changing their habits. And so they will learn these things because they're actively doing them. And obviously, I think that's the way for real retention is when you put it into practice. But before that moment, all of it's kind of, not real until it happens. And so we just give them so much information every single time we're with them, um, that we hope that at some point, if they are uncomfortable or they have questions or they want clarification, that they feel comfortable saying, hey, talk to me about that again. I don't really understand that.
So one of the things that you mentioned, not everyone that is watching this podcast is going to be an expert in and familiar with the transplant system. Can you briefly describe, when you were talking about waitlisting before, what that experience is like for a patient? Why did they go on it? What is it like? And then how do you reinforce, when you were saying like there will be times when they're not going to see you for weeks or months at a time while they're waitlisted or while they're in the middle of this evaluation stage? What is that like? How do you get them to change their lifestyle?
The eval process for the eval process for a transplant center is it's pretty complex. As people progress to end stage kidney disease, most of them are on dialysis and are talking with their nephrologists, and then they get referred over to a transplant center, and we review that referral, and then bring them in for an evaluation. And so that eval process is a combination of coming into the transplant clinic and meeting with 4 or 5 different providers. So transplant surgeon, transplant nephrologist, social worker, our transplant coordinator, our dietitian, um, our financial coordinators, and go through a whole host of information pertaining to each provider's specialty. So obviously when I go in, I'm talking about surgical risks and surgical candidacy. When the financial coordinator goes in, she's talking about insurance coverage and those types of things, and co-pays and things like that. So they get a pretty big swath of people talking to them about different aspects of transplant, which is overwhelming. They get a lot of lab tests done that day, and then we also schedule them for a testing outside of that to determine whether or not they're healthy enough to undergo a kidney transplant. So um, people who have kidney disease tend to also have diabetes and or hypertension, diabetes being the number one cause of kidney disease and hypertension being the number 2 cause of kidney disease in the United States. And both of those lend themselves to cardiovascular disease. So they get a really thorough heart workup to make sure that they're healthy enough to undergo the operation and survive after get kidney transplant. Um, and then whatever other tests that we may need to do. So colonoscopies, pap smears, mammograms, PSA for men, all of those things get checked. Essentially, it's the best workup you'll get at any physician's office. We will take a look at every single thing, and then we will follow up on it. And so that process, you can imagine, can take weeks to months, depending on how quickly you could get your colonoscopy done, how quickly you can get in to see a cardiologist to get a left heart cath or something along those lines, depending on what testing you need. And so by the time someone comes to our transplant office for an eval to the time that they actually get on the wait list or approved, can be anywhere between 3 months and a year, right? Depending on how fast they get their testing done. And when I say approved, just because people get through all those tests, some of those tests may tell us that, hey, maybe transplant's not the best idea for you. If you have really bad burden of cardiac disease and you're at risk for, heart attacks and heart failure after a kidney transplant alone, we may say, you know what? Kidney transplant is more likely to hurt you than it is to help you. And so people may go through the evaluation process and find out that they're not candidates for a kidney transplant, even after doing all of that testing. So once you get to all that testing, we review it as a group. We meet weekly to look at people who finish all their testing and make a decision as to whether or not they're candidates to become, go on the National Kidney Transplant wait list. And once we make that decision, they get a phone call and saying, hey, you've been listed. Or if you get denied, we also call you and tell you that too. And once you are on the list, we then have you come to our waitlist management class, where we go through all the things you need to do to be ready for a kidney transplant, whether that's, making sure you have a bag pack, make sure you answer all of your phone calls, make sure you keep up on all your cancer screenings, make sure that you're coming to your annual visits, and make sure that you are sending blood off every month. Like, there's a lot of things that the patients have to do to maintain their candidacy while on the wait list. And so even though we see them yearly, we have multiple points of contact in between there where we are getting things done, following up on things. And once people are listed, they're pretty in tune with the fact, like, hey, I can get a phone call at any moment.
Mhm.
And they're very excited about that prospect. And, they try to keep in contact with us. And there are certain people we follow up with more frequently than that. Some people get seen every 3 months, depending on, if they're high risk for one thing or another. But we tend to have pretty good contact with them in between visits. And then we always ask them, of course, like, if there's any change in your health, change in your insurance, please let us know. And our insurance folks are following up every couple months on every single patient to make sure we're still in network. There are a lot of different things that need to be done to make sure that a patient's transplant ready. And then once they get that phone call, coming into the hospital, getting an operation, and then recovery starts. So it is very, very involved. Like I said, not everybody gets through the process. And I would say the vast majority of patients who come through our doors aren't listed because they're either too sick or what have you. They have something that disqualifies them. But even with that, we are still seeing record numbers of people being listed, and the number of transplants we're doing every year is not keeping up. So the list gets longer and longer every year. So I think we're close to 90 to 100,000 people on the kidney transplant wait list right now. So that list is just enormous, and more reasons why people need to be donors, and also consider living donation if you're healthy enough.
Right. Right. Yeah. And like you said, the living donor survivability is better and longer. Quality of life is better. So that's a huge process. So if you had, say, an unlimited budget and you could do anything you wanted, what do you think would be the most valuable thing that you would change or add to our existing healthcare system to improve either survivability or the number of people that you can help who are in your field?
Yeah, that is a very interesting question, Lars. I've never been asked that question. So, um, if I had an unlimited budget, I think that there would need to be a huge educational campaign facing towards the general population, because there are obviously people within kidney disease, and people who get transplanted understand some of the nuances of it. But I think there's a lot of information that the general public doesn't understand about their health and how the process works. And so I think transplant tends to operate in a field that's a little bit opaque to the general population. I think there needs to be a lot more transparency about how it works so that people are comfortable with it. I think once people are comfortable with the transplant process and the process of donation, organ donation, whether that's a living donor or deceased donor, if people are comfortable with that process, I think a lot more people will be willing to go through it. And I think we could see much larger number of people willing to donate organs while they're alive. And then also much larger numbers of people who would be willing to donate organs if they were to pass away. And so I think there would need to be a huge publicly facing education system that went in place to get the general population comfortable with transplantation, so that it's not seen as, people stealing organs in the dark at midnight. I think a lot of people are afraid when they go to the hospital, if they're sick, or their loved one's sick and they were to pass away. There's a lot of fear surrounding that in transplantation in particular, about what type of care they would receive. And I think the public needs to know that, the organ process, or the organ donation process, does not start in any way, shape, or form until someone is legally found to be brain dead or considered for donor after cardiac death. And the physicians who are taking care of patients in the hospital when they're at those last moments in their lives are not involved in the transplant process, and they are not responsible for sending people to the organ procurement organization. And that is something that's completely separate, so that physicians taking care of patients in the hospital do not participate in the transplant process at all. And so you don't have to be afraid when you're getting cared for in the hospital, thinking that those physicians have any stake in transplantation. And so, I think that comes from an element of education, but also we'd have to really work on public trust by being more transparent about how the transplant program or the transplant system in the United States works. And so I think taking that would be something that could change transplantation drastically. But even without that, I've seen some very promising numbers in that. I think 13,000 people were interviewed and in a kind of a general survey, and 25% of those people said that they would be willing to donate a kidney to a stranger. And so that's huge. I think the fact that 25% of a pretty large swath of the population, or at least you can hopefully generalize that to the population just based on those numbers. There's a lot of people wanting to help others. And if we were able to let them know how they could do it and what that process looks like, I think we really, really could make a dent in terms of getting people comfortable with transplantation in the U.S.
Yeah, you and I definitely share that same passion for how education can really change the way people live their lives and how that can improve the quality of life for everyone. It's the rising tide that lifts all boats. If everyone understands what transplant is, how it works, how they can help other people, it can have far-reaching effects. And that 25% number to me is very encouraging. It gives me a lot of hope for people. There's sort of this general sense that people are a little bit more selfish these days, but when you see numbers like that, the reality is there are good people everywhere. And 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 I really appreciate what you were saying about being able to educate people and give them the opportunity to be able to help. And that specific example you gave about the fear of patients worrying if they go into a hospital is, that there's a clear separation between your care provider and the organ procurement that would eventually become donated to somebody else. That I think that's an important distinction as well. So, if you were going to leave one last message for, say a patient or a provider, what do you think your lasting mark on the healthcare system, just in general, would be? What would you say if there was someone that was going to walk away from watching this podcast with some amount of wisdom that you've been able to gather through your many years of practice and helping people, what do you think the most important thing would be?
I mentioned it earlier when we were talking about the initial conversation I had with patients. I think a lot of people look at healthcare um, it's a little bit authoritarian in the sense that when you go to your doctor, you have to do what your doctor says, and that we are experts who are here to kind of dictate how you live your life, whether that's medications or how you exercise or what you eat. Um, I would love for people to walk away from this thinking, I do need to take ownership of my healthcare in the sense that I need to understand my disease processes. I always tell everyone in my family, my patients, like if you are having something done, um, whether that's a chest x-ray, an EKG, lab work, not only should you know what those results are, but you should know why they're getting done and what the physicians are looking for, because you want to understand why you're getting those things done and what's happening next. And so if anything, I would just really, really implore everybody listening to really take a look at how they are interacting with the healthcare system and realize that the healthcare system is a service industry meant to better your health. And therefore, when you go into every one of your doctor's offices, feel empowered to ask the questions that you feel uncomfortable asking, because at the end of the day, those things are happening to you. They're not happening to your doctor. And so you are the person receiving a service from the healthcare industry. And we need to start holding every aspect of it accountable, whether that's physicians, insurance companies, hospitals, and say, hey, I am the consumer of this product. We need to make it work for us. And just would say that is the most important thing. And that's outside of transplant, that's outside of everything. No one's going to take better care of yourself than you. And you need to understand everything that's being done and hold on to that and make sure that you are staying up on all of your medical history and know what the process is and what you're going through. And if you have questions, ask, and don't take no for an answer. Don't take a no callback as an answer. Keep calling, keep asking, because you are the consumer. You are the person who's being cared for.
It is really valuable. And I have so much great gratitude for our conversation today. We are both, my mom was an immigrant from Panama and worked in transplant social work for many years. And similarly, you come from a family of people who cared a lot about other people. And I think that we all serve a very important role in how we can help the world around us. And I am so grateful for you being here and for sharing your story, your wisdom with everyone. And again, have a great rest of your day. And I'm looking forward to working with you and learning more about your journey and continuing to help people. So thank you again so much for being here.
Yeah, Lars, thank you. The conversation was great. Thank you for having me on. I really appreciate that.
Healthcare can be confusing. Patients are often asked to make important choices, follow instructions, and prepare for care without enough clear guidance. Vala Bright helps healthcare teams build automated education journeys with an intuitive, user-friendly platform. Messages are personalized and include surveys to confirm comprehension and conduct health checks. Education is a true multimedia experience with detailed ADA-compliant guides, audio, and video. Everything is explained in plain, easy-to-understand language. Our team also creates custom videos that help patients feel more informed, more prepared, and more connected to their care team. Whether you're a patient, a provider, or a practice administrator, Vala Bright helps make care easier to understand, practices more efficient, and people healthier. Vala Bright is already supporting patient education in private practices, clinics, and hospitals. If you want to modernize your education, visit valabright.com to see how we can help you close the care gap.